Our Special Populations Project is individuals with cancer. Like Professor Rogers said in class, cancer is made of 200 diseases characterized by uncontrolled growth and spread of abnormal cells resulting from damage to DNA by internal factors like inherited mutations and environmental exposures like tobacco smoke. Cancer is classified according to cell type from which it originates. Carcinomas, which account for about 80% of all cancers, develop from epithelial cells of organs. Leukemia occurs in blood, forming tissues including bone marrow and lymphatic system. Lymphoma includes the immune system, and lastly, sarcoma affects connective tissue. Cancer occurs in 1 of 2 men and 1 in 3 women, and occurs in 78% of adults older than 55 years of age. There is a strong likelihood these individuals will have other diseases like diabetes, cardiopulmonary disease, osteoporosis, and arthritis. Since this disease is prevalent, you may work with this population in a cardiac rehab setting, PT clinic, inpatient care, or general gym setting. Individuals may respond differently to exercise depending on their diagnosis. It's important to know how the individual has been affected by their cancer experience. For example, a woman with breast cancer may respond differently to inflammation or injury on the side of her body where the lymph node was removed. Cancer and cancer therapy may affect health-related components to physical fitness, like cardiorespiratory fitness, strength and endurance, body composition, flexibility, and neuromotor function. Side effects like nausea or fatigue may limit the ability to exercise during and after treatment. Their overall physical function may be diminished. Even those 5 years post-treatment report difficulties in kneeling, crouching, standing for 2 hours, lifting or carrying 10 pounds, and walking a quarter of a mile. Again, it is important to recognize they may have other diseases, so fitness professionals need to be aware of those considerations. ACSM recommends general medical assessment prior to exercise. Evaluate for peripheral neuropathies and musculoskeletal morbidities. Those who received hormonal therapy should evaluate risk for fractures. Known metastatic disease to bone should be evaluated to determine what is safe prior to the start of exercise. This risk will vary. Fitness professionals should consult with the patient's medical team to determine this likelihood. Medical assessment for metastasis is not recommended for all survivors. Prior to exercise, breast cancer patients should be evaluated for arm and shoulder morbidity prior to any upper body exercise. Anyone with prostate cancer should be evaluated for muscle strength and wasting. Those with colon cancer need to be evaluated as having established a consistent and proactive infection prevention for existing ostomy prior to engaging in exercise more vigorous than walking. Gynecologic patients with morbid obesity may require additional medical assessment for safety beyond cancer-specific risk. Evaluation of lower extremity lymphedema prior to vigorous aerobic or resistance exercise. However, no assessments are required to start light-intensity walking, progressive resistance training, or flexibility programs for most survivors. Consult the individual's medical team to determine what is best for them. Here are a few things to be mindful of when working with these individuals. Generally, avoid inactivity. Return to normal daily activities as soon as possible after surgery. Exercise as much as possible during and after non-surgical treatments, and individuals with known metastatic bone disease will require modifications to avoid fractures. Individuals with cardiac conditions may require modifications and greater supervision. Those with bone cancer shouldn't be lifting heavy due to increased risk of fracture. Instead, try swimming or even yoga. Those with low immunity shouldn't be exercising in a public gym. Ask the patient's doctors when it is safe to participate in a local setting or try exercises they can do in their own environment. It may be more beneficial for those experiencing peripheral neuropathy to use a stationary bike instead of other weight-bearing exercises. It is safe for women with breast cancer to exercise their upper body, but be sure to do so slowly, with low resistance, and progress very slowly.
Special considerations for aerobic exercise. When training individuals with breast or colon cancer, you should be aware of an increased risk of fracture. Physician permission is recommended for patients with an ostomy prior to participation in contact sports. Swimming should also be avoided if an ostomy is present. Individuals with adult HSCT are okay to exercise. However, it is recommended that they exercise at a lighter intensity and have a lower progression of intensity. In the presence of gynecologic cancers, morbidly obese women may require additional supervision and altered training. Special considerations for resistance exercise. When training patients with breast cancer, it is recommended that they start with a supervised program of at least 16 sessions and very low resistance progress in small increments. You should watch for arm and shoulder symptoms, including lymphedema, and reduce or stop exercise according to response. If a break is taken, lower the level of resistance by 2 weeks, worth for every week with no exercise. Patients with prostate cancer should add pelvic floor exercises for those who undergo radical prostatectomy. Colon cancer patients with a stoma should start with a low resistance and progress slowly to avoid herniation in stoma. Resistance training might be better for individuals with adult HSCT. Patients with gynecological cancer should proceed with caution if they have had lymph node removal and/or radiation to lymph nodes in the groin. Flexibility and other considerations. Avoid excessive intra-abdominal pressure for colon cancer patients with ostomies. Yoga is safe as long as arm and shoulder morbidities are taken into consideration for breast cancer patients. Research showing the benefits of exercise on cancer have shown lower hormone levels associated with development of cancer, prevents obesity and its harmful effects, reduces inflammation, improves immune function, and alters metabolism of bile acid, as well as decreases time food travels through the digestive tract, which decreases exposure time of harmful carcinogens to the GI tract. Research showing the benefits of exercise on cancer continued. Reduced physical fitness and side effects of treatment lead to weight gain and are linked to worse survival rates and quality of life compared to those who participate in physical activity. Improved quality of life in terms of self-esteem, sleep quality, emotional well-being, sexuality, social functioning, anxiety, fatigue, and pain. Evidence consistently shows physical activity following diagnosis leads to better breast cancer outcomes with as much activity as walking 3 to 5 hours a week. A study on colorectal cancer patients found leisure activities that included physical activity decreased risk of dying from the cancer by 31%. Shown here is the FIT principle for individuals who were diagnosed with cancer. Frequency for aerobic activity is 3 to 5 days a week. Resistance training, 2 to 3 days a week. Flexibility, 2 to 3 days a week, with daily being most effective. For aerobic training, intensity should be kept to moderate to vigorous. As for resistance training, they should start with low resistance, less than 30% of their 1 repetition maximum, and progress with smallest increments possible. As for flexibility's intensity, they should move through the range of motion that is tolerated. The time spent performing aerobic exercise should be 75 minutes a week of vigorous intensity or 150 minutes per week of moderate intensity, or an equivalent combo of the two. For resistance training, there should be at least 1 set of 8 to 12 reps. As for flexibility, there should be 10 to 30 seconds hold for each static stretch. The type of aerobic activity should be prolonged rhythmic activities using large muscle groups, for example, walking or cycling or swimming. Resistance training should be with free weights, resistance machines, or weight-bearing functional tasks, for example, sit to stand. The exercises chosen should include all major muscle groups. Stretching or range of motion exercises for all major muscle groups should be included. The trainer should address specific areas of joint or muscle restriction that may have resulted from treatment with steroids, radiation, or surgery. Here are a few examples of exercises that could be utilized when training individuals with cancer. Like previously mentioned, free weights are an okay way to perform resistance training as long as low resistance is used. In this example, the subject is performing a chest press with dumbbells while focusing on good form. When performing a chest press exercise with patients with breast cancer, it is important to be mindful of their range of motion. As you can see here, Lisa is paying close attention to the subject's form while providing lots of motivation and encouragement.
Here the subject is performing a sit-to-stand exercise. After the subject is comfortable with body weight resistance, they progress to a weighted version of the exercise.
Again, the subject starts with a modified version of the plank, and then when comfortable, progresses to a more challenging version of the exercise.
It is important to include a proper warm-up and cool-down for each exercise session, but remember to only static stretch warmed-up muscles. Here the subject is performing stretches that focus on major muscle groups. Each stretch should be held for 10 to 30 seconds, stretching to mild discomfort. Each flexibility exercise should be repeated 2 to 4 times.
Here's a study that looked at exercise's effects on fatigue during cancer treatment. The purpose of the study was to determine whether a simple, at-home exercise intervention would prove to be beneficial in combating fatigue associated with cancer and its treatment. 52 women that were currently undergoing cancer treatment were recruited. They were each randomly assigned either a walking routine or normal care during their chemo or radiation therapy. Symptoms, physical function, and quality of life were all measured before, mid-treatment, and after treatment. The results showed that those who participated in the walking routine intervention showed better physical function and overall quality of life. It was determined that even a simple at-home walking routine can be a beneficial and inexpensive way to improve overall quality of life for women undergoing breast cancer treatment. Here is one of many research articles that investigated exercise effects on cancer. 2 main concerns were investigated. Number 1, exercise effects on cancer recurrence and mortality. Number 2, exercise effects on adverse side effects from cancer treatments. A meta-analysis of 100 peer-reviewed articles was performed. The articles were found in the following journals: PubMed, Medline, Cochrane Central Register of Controlled Trials databases. The results showed that those who exercised showed a significantly lower risk of cancer recurrence, cancer-related mortality, and all-cause mortality. They also showed adverse side effects of treatment, including bone health, sexual health, bowel and bladder health, cognitive health, and fatigue were all significantly better in those who went through an exercise program during treatment. Specifically, superior levels of exercise following a cancer diagnosis were associated with 28 to 44% reduced risk of cancer-specific mortality, and a 21% to 35% lower risk of cancer recurrence, and a 25% to 48% decreased risk of all-cause mortality. This concludes our presentation on training individuals who have been diagnosed with or who are recovering from cancer and its treatment. I hope this presentation has helped you all understand the needs and special considerations of training those with cancer. In the following video, Dr. Melinda Irwin and physical therapist Scott Capozza will review what we just learned and express how important it is for those with cancer to remain active.
There's been an increasing number of studies over the years, especially over the past 10 years, looking at the role of exercise in decreasing the risk of cancer. And these studies, over 100 studies, have shown about a 50% reduction in the risk of getting cancer, specifically breast and colon cancer. A growing number of studies show a reduced risk for ovarian cancer, endometrial cancer as well. And now more recently, in the last couple of years, there's been studies showing that exercise can also improve your survival after a cancer diagnosis. There's been studies showing that about a year after your diagnosis, if you exercise about 30 minutes a day, or say 2 to 3 hours per week, doing a moderate intensity activity such as brisk walking or bicycling, you can decrease your risk of recurrence approximately by about 50%. People undergoing treatment, chemotherapy or radiation, the number one side effect is fatigue, and so they think the last thing they want to do is exercise. How could exercise actually improve fatigue? But it actually does. So there's studies that have been done showing that if you start an exercise program, you'll be less fatigued, you'll have less nausea, and then it's also associated with other improving other side effects of surgery, such as lymphedema, and other side effects of treatment.
Exercise is very important for cancer survivors on a couple different levels. I think first, from a physical standpoint, you are increasing your heart rate, your respiratory rate, you're helping your body heal, especially in the sense of chemotherapy. You're helping with increased circulation to help flush some of that chemotherapy out of your system. With increased circulation, you're also getting more blood flow to areas where you had surgery, so that helps with healing at the surgical sites as well. From an emotional standpoint, I think it's very important for the cancer survivor to prove that they're still fighting and they're still winning their battle against cancer.
If you've never been an exerciser or been involved in any kind of sports or recreational program, basically starting with something is better than nothing. So for some women or men who are undergoing treatment, it may be being able to walk to the mailbox or walking to the neighbor's house, or so working up to just doing a 10-minute consecutive bout of walking at a brisk intensity. Maybe walking in the mall to get some exercise. So starting with just 10 minutes a day, maybe 3 10-minute bouts throughout the day, could be considered exercise for that person. Someone who had been doing an exercise program, maybe even something what we call like the weekend warrior, where they only exercised on the Saturday. They got out and they did an hour-long hike at a park with their family. They were doing something, but it was just more on a 1 or 2 days a week. So for them, it might be establishing a routine where they do something 3-4 days a week for 30 minutes. And then, of course, the person who was more of an avid exerciser, it would be ideally getting back to the program they were doing before their diagnosis, and maybe even pushing themselves a little bit more to, maybe they had that goal. Maybe I'd like to participate in a 10K race. So it's all dependent on where you were before maybe your diagnosis, or what your lifestyle was earlier, and then kind of building from there. But my motto is always something is better than nothing.
A lot of times for people who are a little more apprehensive about exercising, I might recommend maybe not necessarily a support group, but to find 1 or 2 people that you feel very comfortable with and say, talk to them and see if you can, get together like a little neighborhood walk, or meet a neighbor, down at the beach or something like that for a walk. So that way you have a little bit of support while you're actually out exercising.
What's really important to realize is that nowadays there are certified exercise trainers, certified cancer exercise trainers who can work with you to develop a safe exercise program, strength and aerobic exercise program, dependent on your cancer type, the surgery, the treatment you had, your time since diagnosis, what was your activity level before your diagnosis. And these certified trainers are certified through the American Cancer Society and the American College of Sports Medicine. And they are national, so you could find one in your state or in your community, and perhaps work with him or her to develop an exercise program.
The important thing about being a cancer patient and being a cancer survivor is still staying true to who you are. Don't let the cancer define you. Don't let the cancer take you over. You're still who you are at your heart. So continue to live your life to the best of your ability. If you're in treatment and you have to make modifications, then so be it. But it's better to make modifications than to not live your life the way that you're used to living it. So I think that's true if you're in treatment, and I think that's true in cancer survivorship as well.